So I want to turn it over now to Bill, who will spend about 5 minutes sharing his perspective on physical activity in schools and the work that he's been doing.
Yeah, thanks, Chris, and thanks to the organizing committee and Bill and the others. It's incredibly important, and I was really pleased to see that there's a special session particularly dedicated to physical activity because there's so much to do. Chris's new results, I think, are really encouraging. But as Jim mentioned, our physical activity and physical education in schools report from a couple years ago here at the IOM really emphasized 6 key strategies that not only are evidence-based, but actually have multi-level ideas for implementation. We really pushed to not just make another academic report, but also to say, okay, what can people at the federal, state, school, classroom levels do to make sure that some of these things get implemented? Obviously, one of them is the whole of school approach. Not just physical education any longer. We know that even the best PE programs don't get kids active for more than 10 to 15 minutes. If 60 minutes is the recommendation, then we've got a whole bunch of work to do. But some other innovative things I think that are being tried in other places include one of my favorites, which is considering physical activity in all policies related to schools and school development. We've seen the development of things like sugar-free break times or birthday parties, things like that. Thinking about how to integrate physical activity into that kind of a policy. School siting, where to put new schools or rehab old neighborhood schools so that active transport to school becomes easier. Not usually the realm of the education department. It's sometimes the city planners and other people who are doing it. But I'm a firm believer, after years of stumbles, I guess, it's not just a single point of intervention. We have to think more about the systems in which our children live. We have to be thinking that they come across the health sector, the transportation sector, the education sector, the recreation sector virtually every day. And how do we, A, make those more accessible, and B, make those relevant for participation in physical activity. Third, and I think we've made some progress on this, make physical education a core subject. Just like mathematics and just like reading, making it a federally described or federally determined core subject for all of our schools to understand and be able to measure. The funny thing is, a lot of justification we heard for trying to increase test scores in the past was we need to sit kids down and have them more in tune with classes and learning more so that we can raise test scores. When in fact, what we're learning about the role that physical activity plays in cognitive development and in academic performance, we actually may be holding test scores down by keeping kids more sedentary in class. Active kids learn faster and they remember more than their inactive counterparts. Whether that translates to better test scores and academic performance, there's a lot of other things that go into that, but the evidence, I think, is suggestive, and I think we should absolutely pursue that. We need to measure things better. We measure math and reading performance. If physical education and physical activity is that important, which I believe it is to learning as well as to health, we need to measure it. We've put billions of dollars into school nutrition programs, scoliosis screening, hearing, vision screening, all with the idea that healthy kids learn better. What we're learning now is that active kids learn better, and we should be putting, and I think, an equal amount of attention to using the schools to leverage that together. Two of the final recommendations, making training pre-service as well as continuing education, not just for PE teachers, but for classroom teachers and administrators. Focus on physical activity more and the role that physical activity plays, not only in schools, but in learning in particular. And then finally, reducing disparities in access. Jim highlighted that very well. There are schools without adequate physical education. They are predominantly in the lower SES schools. That's just unacceptable from a public health standpoint. The cornerstone in public health is reducing disparities, and there's evidence that we need to do a lot of work to be able to do that at multiple levels, starting from a local demand level, whether it's an advocate in the school or a school board or a state board of education. All those multiple levels can influence that. The report and the work that's followed from that tries to highlight ways to be able to do that and to make progress using the school as the hub. And I think it can be done.
Great. Thank you, Bill. That was